You have been diagnosed with latent tuberculosis infection. This means that tuberculosis bacteria are residing inside your body, but you are not currently sick or able to transmit the disease to others. Although you do not presently feel ill, it is medically advisable that you receive antibiotic treatment to eliminate the tuberculosis bacteria. That's because 5 to 10% of individuals with untreated latent tuberculosis infection will eventually develop active tuberculosis disease. Taking targeted antibiotics is the best way to reduce that possibility. You can receive a prescription for antibiotics from your primary care provider, an infectious disease specialist, your local health department, or an immigrant specialty clinic. Prior to starting treatment, you will need to undergo additional blood tests to give your doctor a better sense of your health status. Based on your medical history and the results of the additional blood tests, the doctor will decide which antibiotic regimen is right for you. The newest and generally most favored antibiotic treatment consists of 2 medications taken simultaneously, rifapentine and isoniazid. Most people who are prescribed this regimen will need to take 3 tablets of isoniazid, 6 tablets of rifapentine, and 3 tablets of vitamin B6, pyroxidine once a week for 12 weeks. Latent tuberculosis medication can be expensive, especially if you do not have insurance coverage. Fortunately, many health departments in the USA provide the medication free of charge to individuals who test positive for LTBI. It is important to be aware that in some cases, the antibiotics given to treat latent tuberculosis can have side effects. Regimens containing rifapentine, for example, may cause your urine, saliva, and tears to have a reddish-orange tint. This is not indicative of a health issue, and you should not be concerned. On the other hand, there are certain potential side effects which may signal that the medication is interacting with your body in an unsafe way. These include loss of appetite, nausea or vomiting, brown urine, yellowing of the skin or eyes, persistent tingling or numbness, burning of hands or feet, persistent weakness or fatigue, fever or abdominal tenderness, easy bruising or bleeding, and blurred or changed vision. If you experience any of these symptoms, please contact the doctor overseeing your treatment immediately. Once you have finished the full course of medication for latent tuberculosis, you will receive a certificate of completion. Keep this document in a safe place. If you get retested for tuberculosis in the future, it is possible for your result to still show as positive. This is to be expected and does not necessarily mean that the treatment failed. However, if at any point you experience symptoms which are typical of active tuberculosis, such as a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood, fatigue, weight loss, lack of appetite, fever, and/or night sweats, please contact your health provider immediately and mention that you were previously treated for latent tuberculosis infection.